Urinary incontinence is loss of urine without control. So basically, it can be coughing, laughing, sneezing, urine loss. It can be exercise-induced urine loss. It can be urgency and frequency and running to the bathroom urine loss. It can be waking up in the middle of the night and losing urine on the way to the bathroom, or sometimes without even any warning, a woman finds her underwear wet or her pad wet, and that can be also or considered a urinary incontinence. The anatomy of the pelvis is if we consider this is the abdominal wall, this is the pelvic area, this is the clitoris, this is the labia majora on the outside, and this is the vaginal opening. The first opening is the urethra, where we urinate from, which leads into the bladder. Then the vaginal area, which leads to the cervix and the uterus, and of course the rectum and the colon. So what causes urinary incontinence is either damage to the nervous structure of the bladder, meaning that the bladder cannot control the muscle contractions. Bladder is a muscular organ, and it relaxes to hold urine. But when the muscle is irritable, or you may have heard irritable bladder is when the bladder becomes irritable and the muscle contracts without the brain or a person's body able to control that irritability, and the urine leaks. Then other times there's stress urinary incontinence you may have heard of, and that is when there's pressure on the bladder from a cough, from a jump, from a sneeze, from straining, and the muscle at the neck of the bladder will not be able to hold the urine inside, and the urine leaks out. Stress urinary incontinence can also be from the connective tissues that support the neck of the bladder that can be damaged either with vaginal delivery or chronic stress or chronic constipation, chronic cough, and asthmatics sometimes.